So the myPath test has now been in clinical use for more than 6 years. At my last count, there were more than 14 individual peer-reviewed manuscripts in the literature describing the test's accuracy and discussing its benefits and limitations, pros and cons. And in March of 2019, CMS, the Center for Medicare Services, issued a positive coverage decision for the myPath test based on the already existing evidence. So the question becomes, what is sufficient evidence? What is the standard? Because if the evidence for the myPath test is still insufficient, where does that leave immunohistochemistry? Most of us use immunohistochemical stains every day, but most of them are never subjected to even a single clinical validation study, let alone multiple clinical validation studies. And there's very little evidence that they have any positive impact on patient outcomes. There are some things that we still don't know about the myPath test, as there are for every ancillary test. And for that matter, there are some things that we still don't know about diagnosis by histopathology. But one thing we do know is that in a certain percentage of cases, diagnosis by histopathology produces uncertain or controversial diagnoses. When a lesion is ambiguous by histopathology, diagnosis by histopathology is by definition less reliable. And in those circumstances, I think it makes sense to at least consider obtaining diagnostic support from an ancillary test. There will probably be some for whom no level of evidence that could ever be provided will be considered sufficient. But we also have to recognize that for some, insufficient evidence has become a form of shorthand for thing I don't understand or thing that I just don't like.